Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So this is good news from Lollapalooza, but I think a lot of people are thinking, well, why are we worried about shutting everything down again? If we have all these people packed in and there was not many cases, why does it seem like things are trending in the other direction? Explain that.
Yeah, okay. I think the Lollapalooza effect is really quite phenomenal. This ended up not being a super spreader event, despite Delta virus. But remember, A, it was outdoors. B, it required vaccination. And they say that over 90% of the people did present the vaccination card. The other 10% had been recently tested. This is a great example of how herd immunity is supposed to work. So if 90% of the population was vaccinated, you wouldn't have to have any of these restrictions now.
Gotcha.
I know that you are very excited, as so many other people are, about the booster for people who have immunocompromised systems or have had transplants or so on. Tell me a little bit about this being a move in the right direction.
Yeah. So these people, the immunocompromised patients, like an organ transplant patient, somebody on high-dose steroids, many of the patients with cancer and other immunocompromised type diseases, they were excluded from the original study. So they didn't know how well the vaccine was going to work. We know with influenza and with hepatitis B, people with immunocompromised conditions, even the elderly, require a bigger dose. All right. So, the preliminary studies show that these people do respond to a third dose, and that was what was approved yesterday.
What do we think about the regular population getting a third dose? Right. Is that going to happen?
It's going to happen, but Robin, the question is when. Right now, it does not look like the boosters are failing at this particular. The regular dosing is failing at this particular time, so there's no need for a booster now. And we should wait until we need it, because by the time we need the booster, there may be a new vaccine. They may be version 2 that's better for Delta or something like that. So there's no point getting a booster if you don't need it. Right now, these booster shots are for the immunocompromised.
Gotcha. All right, let's go to questions from our viewers. The first one says, I am immunosuppressed, and when the FDA approved the booster shot, I will get it. Can I get the Pfizer with my previous Moderna shots, or do I have to stay with Moderna?
This is a good question. It didn't get spelled out in the guideline. I don't think it really makes a difference. Just get whatever you can get.
All right. This person says, how concerned should we be about unvaccinated children under 12? Although in school with masks is great, last year we didn't have the more contagious Delta variant.
Yeah, no, this is a problem. The unvaccinated pools of people, including kids under 12, are really what are going to fuel this epidemic. Now, the good news is a vaccine is going to be approved very soon for age 4 to 11. And so this conversation will stop.
Perfect. All right, here's another one. Do you think we'll see long hauler symptoms in vaccinated people who get COVID?
I wish I had the answer to this question. The problem with the long haulers and people who are not vaccinated, we already know it's about 14% will continue to have symptoms after up to 6 months that they find these symptoms and reported in the health records of these people. So that's the general kind of number that we're working with. So we have to wait and see what happens. It's certainly anecdotally reported already, but those are anecdotes. So we need some science behind it to really come up. Are they going to have the same amount? Are they going to have less or hardly any? We don't know.
Thank you. Thank you, Dr. Murphy. If you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our Morning News Facebook page and post one there. We'll talk to Dr. Murphy again on Monday.
Have a good weekend.